Hi there, everyone. Welcome to another episode of The Whole Home Show. I'm Tony Joe, your host here every week, bringing you tips, education, and updates on home-related matters, all things real estate. Whether you're in the market or if you're looking for decorating or improvement ideas or other ways to make sure that your house remains your castle and well-maintained, this is a great place to be because you get to meet service providers, trades, and a whole bunch of other great specialists who will provide you advice on things that you want to know. Our show comes to you every week with the support of our show partners. Denise Webster, mortgage broker with Dominion Lending Center's Modern Mortgage Group. JP Sellers, insurance advisor at Westland Insurance. The Sitka Law Group for your real estate, wills and estates, corporate and personal injury needs. And Shoreline Inspections with Reese Jacob and Monica Gass. If you need help or direction in your real estate transaction, give any of the Whole Home Show team members a call. They would love to hear from you. You can find their contact information by visiting CFAX1070.com. Go to shows, and there you'll find us, The Whole Home Show, with me, Tony Joe. All their contact information is there. Or feel free to reach out to me. I hear from listeners every week, and I love it. So if you'd like to connect with any of them or even myself, just give me a call. You can find me by Googling Tony Joe Real Estate online, or visit the Prime Real Estate Team, primeteam.ca. I love hosting this program for you. I've been doing it now we're in our fourth year right now. Episode 178, according to my clock here. By the way, if you want to listen to some of the older episodes, and a lot of it is evergreen, by the way. Evergreen means that it's not dated. You know, we've interviewed so many different trades and specialists who could help you right now, even though maybe we recorded them 3 years ago or 2 years ago. Great information. If you're a podcast listener, go to iTunes or Google Play and you can download any of our episodes there. They're all there. Or just reach out to me. I'd be happy to help you. Today, we're talking about living again in the time of COVID and how we are doing things somewhat differently now. I'm not just talking we as in real estate, we as in the community at large. How do you do things like get doctor's appointments? How do you do things like get your prescriptions and your pharmaceuticals? Because we're home now. We're self-isolating. We're maybe doing things around the house like landscaping, puttering around, doing improvements, but we also need to live as well too. And how are we adjusting our lives such that we can minimize our contact with other human beings? Not that we want to. I mean, socially, this has been very tricky, but we all know, we listen to Dr. Bonnie Henry and all the other experts out there. We have to exist within our bubbles and make sure that we reduce the number of face-to-face contacts that we have with people, minimize them such that it's only the really essential things. Now, there's a lot of people out there that need their doctor, that need to go talk to their GP, get prescription refills, things like that. That's what we're covering today. We're going to be having a chat about TELUS Babylon Health, which is a really nifty program. You can have a doctor's appointment on your smartphone. Also having a conversation with Don Swainson, who's the owner and general manager of Vital Health Pharmacy. It's a great boutique pharmacy right by the Jubilee Hospital. They work hand in hand with telehealth, and they'll be able to help you with your prescription needs. So great program today. We always start our show with a listener question or story. And if you have one, share it with us. Give us a call, 250-414-6540. That's 250-414-6540. Leave a message, please. Make sure you leave your name and phone number, and we will put it on the air on a future episode. Today, I want to talk about a conversation that I had with a client last week, and it's what I like to call the Condo Conundrum. Many of our listeners here might, this might ring true for you, and it might hit close to home, as they say. So here we are. These are people, they have lived in their beautiful home for many years. I can't remember how many, maybe 15 years or so. It's a newer home, very much house proud. We know this as real estate people. When we go into somebody's house, it is pretty clear when somebody is house proud, how meticulous everything is kept, the condition of everything, the yard, you know, and we know that the people didn't just tidy up the house for my visit. It's tidy all the time. That's house proud. Their conundrum is they are aging in place right now. So their home, the thing about their home is there's a number of stairs. Master bedroom is upstairs. There's a number of steps to actually get into the house itself. There's steps down to the backyard. There's a lot of steps, and things start becoming physically a little more difficult over time, or so I'm told. So one of the things that they are considering doing is moving into a condominium, moving into one level living where it'll be much easier and much more physically, as far as no steps, attractive to them. One of the things, of course, most people struggle with is the move from a detached single family home into a strata property. Strata, of course, meaning that you are sharing a lot of the common areas with your neighbors, hallways, elevators, parking areas. If it's a townhouse, it might be the grounds, the driveway, and many aspects like that. Also, too, going from a detached single family home of complete autonomy, so you have no one to answer to. And then all of a sudden you're in a strata where you have things like bylaws, rules, regulations. Are you allowed pets? Are you allowed to have your kids come and visit for a certain number of days during the year? Your grandkids? Can you rent it out if you want to? Are there age restrictions? And a number of things like that. Stratas, of course, have annual general meetings, special general meetings, financial statements, an executive, a whole other level of government, as it were. And for many, that's a bit of a concern, because if you go from living in your home for 40 or 50 years, by the way, we've had clients who have lived in the same home for that long, to all of a sudden consider going into a strata, it's a pretty big step. It really is. It's something to think about. Now, these folks here, ideally what they would really want to do is move to a one-level townhouse that gives them the space that they want. But this is an issue because there's not a lot in Victoria. People often wonder why. How come there aren't more one-level, no-step townhouses out there? Well, simple answer to the question. Developers, of course, take a blank piece of land and they maximize the space and the usage. They develop the property to maximum density to get in as many units as they can. Why do they do that? Well, number one, to please the municipality, of course, because for the municipality, it's a tax base, right? But I mean, let's face it, there has to be some profit in there too for a developer to build these things. Developers don't do this for fun and out of the goodness of their heart. They do it for profit, so they do try to maximize the space. And as a result, most of the townhouses we see are multi-level. There might be 2, 3, even more floors, and there's stairs, and it is frankly more suitable for a younger set. There's not a lot of purpose-built townhouse sites out there for the retiring or retiree set, unfortunately. There were many that were built before, maybe in the 1990s or earlier, but there's just not a lot otherwise. So that's the first thing. There's not a lot because just not a lot are built. So from that, the folks then are thinking, well, maybe a condo is the thing. But see, that's an even bigger jump, because if you're going from a 2,500 square foot house to a condo now, which would be a 2-bedroom unit, would be maybe somewhere around 900 square feet or 1,000 square feet. The math seems vast. To go from 2,500 to 900 just seems like too much for many people. And I get that. I totally get that. One of the things that people often come to grips with when they do make the choice and make the decision is how little of their house they actually use. You think about, obviously you got the kitchen and a living area, or is it the family area you spend time in? Maybe you don't spend time in the other one. I know I have a dining room and a living room that we never use. We pretty well live in the kitchen and the family room area. And it's the same with many of our listeners, I'm sure, as well too. But the big thing is, it is a conundrum. And the math is also a conundrum, because to go from a house that is, say, $900,000 to buy a condo that is $700,000, it seems like you're going from 2,500 square feet to 900 square feet. It would make sense that you should pay a lot less, maybe even a third, but that's not how it works, because the cost per square foot for condos is high. They're all more modern. They have more modern features. If you're looking at steel and concrete, it's even more expensive as well too. It is a conundrum, and the bottom line is this. you need to be ready. You need to discover at that point in time of your life if it makes sense to simplify, and if it makes sense to adjust your lifestyle so that you don't need to think about landscaping, don't need to think about upkeep and maintenance and all that kind of stuff. It comes to people. So that's just one of those things. If you have a question and want to talk about real estate anytime, reach out to us. Happy to help. Again, find our contact information on cfax1070.com or reach me at the Prime Real Estate Team. We're going to need to take a quick break here. When we come back, we'll be talking about telehealth and getting your prescriptions delivered to home. Back in just a moment. Thanks for coming back. You're listening to the Whole Home Show, and I'm Tony Joe. Today we're talking about living under COVID time and how you would normally live about your life, but things are a little different right now. We're all trying to minimize our contacts. We're all trying to minimize, we're living within our bubbles, staying healthy, and listening to Dr. Bonnie Henry and what all the experts are telling us. One of the big things that you begin to wonder about, though, is how do you go about doing things like getting doctor's appointments? And even more importantly, prescriptions. What are you doing to go get your prescriptions? Well, that's our next guest right now. With us is Don Swainson. Don is owner and general manager of Vital Health Pharmacy. Don, thanks for joining us.
Thanks a lot, Tony. Nice to be here.
Yeah, thanks for coming back. Actually, we had you in the studio some time ago, right?
Yeah, that was the pre-COVID studio days. Yeah, well, I guess this is your new studio, so happy
exactly. Well, we're staying safe, right?
Yep. Totally.
Yeah. Okay, so in many ways, you guys at Vital Health were well positioned because you set up a very different business anyways. And when COVID came, I'm going to guess that you guys were pretty well set up to deal with this, right?
Well, we adapted quickly. Like a lot of us, if I sort of roll back the clock to January and February, like even through mid to late February, I don't think, certainly speaking for myself personally, I don't think I knew how big a deal this was going to be. Mm-hmm. Fortunately, we work very closely with a number of physicians, and some of them were starting to get a little worried, mid to late February. And so we were reading and starting to think about preparing. And then by mid-March, after, Dr. Henry had come out and basically started to shut things down particularly after that dental conference. Remember that dental conference?
Oh, yes.
And that was sort of like March, I want to say 8, 9, something like that. So the world really started to change then, as everyone remembers. And so by the next week, though, we were able to adapt really quite quickly. And we actually locked our door and we went to curbside and delivery only as of March 16th, I think was the date. So It was a bit of an adaptation, but you know what? Our patients were really happy. We already did delivery. We just doubled the number of shifts.
Yeah.
And then we kept doing injections and vaccinations too, which is a big part, infusions, which is a big part of what we do. And we're set up differently than a lot of pharmacies, like you said.
So yeah, let's explain to our listeners, let's explain the shop. You're located on 4th Street.
Yeah, I mean, you're located on 4th Street near the Jubilee Hospital. And the biggest thing that's different is we have nurses that work out of our space, and we administer a lot of medications that a lot of pharmacies wouldn't. So IV infusions, we do a lot of iron infusions, we do lots of other meds, biologics for, complex autoimmune diseases that people typically, sometimes they would go to their hospital, or maybe their physician's got a clinic near them. But there's a good number of medications that we can administer. And so, so we've got a lot of, good protocols around, how we manage the risk of an infectious disease. And so that was very familiar to us. Yeah. So when COVID hit, it was a pretty straightforward adaptation for us. I mean, locking the door was a big deal.
For many.
Not letting people in unless they had called ahead or had an appointment with us. That sort of, was a reality for people that maybe took a while to sink in. But people, when they understood, we were putting the safety of our staff and them as patients first to avoid the pharmacy being a site of spread potentially. I think they appreciated it.
So the biggest thing, though, stepping into your door. Right. So stepping into your door at Vital Health Pharmacy is you are not a typical retailer. Like you're
No,
not
no pop and chips. No pop and
no pop
chips.
and chips.
We're
Yeah,
not
and
competing with 7-Eleven. 7-Eleven are
okay.
really good convenience retailers.
So I can't
And
get a chocolate bar. I can't get a
well,
cigarette,
our
right?
staff, our staff actually lobbied that we brought in one chocolate bar. So
Yeah,
you
it's a healthy
could
one
get
though, right?
one. There's
Yeah.
one high cocoa chocolate bar we sell, but other than that, no. There's really no food. It's not. You know, we believe we're a vital health pharmacy, so we're trying to be health only, and we're a small space too. I mean, we do a lot of vaccinations, we do a lot of infusions, and we fill any prescription that people might need. We've got family docs next door that they've had to make a big adaptation in the COVID world, obviously, and a lot more telemedicine, which I know you're talking to others
Yeah.
about, and yeah.
So the biggest thing is this. I mean, for somebody who's faced with the thought of I got to go get my meds,
right,
but they may not want to go into a mega store or a
right,
shop, where you got to go through the aisles of retail.
right.
And people are concerned nowadays, especially our seniors, who should be minimizing their contact, minimizing, going out there. We've got great little shops like you, of which a big part is the delivery side, right?
Right. Massive. Yeah. No, in times like this, it's essential. And, we already had the mechanics and the logistics of delivery figured out. We just had to scale it a little bit, and we hired another driver, and we've added delivery shifts. But yeah, I mean, that's the way people are working around it, and just calling us and saying, I need my prescriptions filled, or we've got an app on our website now that some people use to
Yeah.
order their meds, or a lot of people just pick up the phone, and we try to live answer our phones and get them their meds as quickly as possible.
It's funny, for me, because I've been in your shop, obviously.
Yeah.
For me is interesting because I equate it to, like, those old TV shows from like the 40s or 50s, where you go into, you visit the pharmacist, and all it is the pharmacist is right there. It's like old fashioned, and you get to know them. Right?
Service model. Yeah,
Yeah.
it's a service model. We try to get to know our patients by name and by medical history, and we know a lot of families, and it's an old school service model, but with we're using like modern technology to support us and make sure we keep on top of people's meds, using really good tracking software. And if people want to communicate with us through our app, we've got an app on the Google Play and the App Store, and you can use that. But a lot of people want to pick up the phone. A lot of people want to see us. That's why, locking the door was a big deal. We now let people in the store with a mask on. Yeah. We wear a mask, and we got plexiglass, so it's super safe. But pharmacy's going through a big change right now, Tony. There's a lot of big players in this, but at the end of the day, people want information from somebody they trust, and they need their meds, and they need to know how those meds interact with other things they might be taking, and that's a service model that we think is super important. And then you layer on top of that vaccinations and injections, and those are services that you want to go to somebody you trust that is providing.
And this is this is what we're talking about today, is this whole notion of telehealth. Like, so to be able to have an appointment with a doctor on the smartphone,
right?
And that's weird for some people, because for many, they want to see their doctor, they want to a physical thing, but yet on the other hand, we all know that we've got to be COVID safe, right?
Well, and there was a capacity issue before COVID too, right? There were not a lot of people didn't have doctors. So I think the telemedicine services are fantastic in that they're addressing a capacity gap, and they're also providing an additional service. Now, I personally don't think in-office medical care is ever going away.
No.
Ever.
Yeah.
But I think what has happened is a lot of physician practices have added this on as a necessary, relevant service for a lot of their client constituents, patients, and it's great. It's great. It's a great addition to care.
Yeah, and of course, they work hand in hand with pharmacies like you. So when somebody does their telehealth, they need a prescription filled.
Right.
They they basically tell them where they would like the prescription
Yeah.
filled, and they can say Vital Health Pharmacy, right?
Yeah, patient should get to choose always, 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 always. I mean, that's patient choice is a big part of the premise underlying pharmacy care is that patients get a choice, and they shouldn't be obliged to go anywhere they don't want to go. And if somebody suggests a great service to them, great, they can use that one. But
Yeah.
pharmacies are patients can transfer to whatever pharmacy they want, and that's why we think service is so important, because people will talk about good service and they'll recommend people to good service.
It's like that old-fashioned thing that we're talking about.
Yeah,
and
totally.
that's what I know you guys do really well. So
it's not going away. It's served us well for the last 7.5 years, and yeah.
Fantastic. Your address on Fort Street?
We're 1825 Fort Street. It's
tucked away
near the park end of the Jubilee Hospital. There's a big octagonal building that's now Canada Post.
Yep.
And yeah, so
fantastic.
On that.
Thanks for joining us, Don. And
thanks a lot, Tony.
For anyone who is at home, because this is a real estate show after all,
right,
and needs to think about getting their prescriptions delivered to them, give Vital Health Pharmacy a call. You can find them online. Thanks, Don. We'll catch you next time.
Yeah.
And for the rest of our listeners, just need to take a quick little break. Back in just a moment. Thanks for coming back. You're listening to the Whole Home Show, and I'm Tony Joe. Of course, during this really interesting time with this global pandemic, we've all been living a little bit differently, and life is not the same as we used to know. Of course, we're doing a lot of things nowadays from home, online, that we never did before. People are ordering food, ordering products. It's going to be interesting to see what Christmas looks like. And yes, this is not a great thing for our local businesses. And as a reminder to anyone who listens here, please, please, please support our local businesses and our shops, because it is so, so important. But the fact is, life is different. And especially when it comes to things like health, because as we chatted before the break with Don Swainson at Vital Health Pharmacy there, it is a very interesting proposition for anyone who needs medical help and services right now. What do you do? Where do you go? What's the lineup situation either at your GP or the clinic? Well, we have another alternative for you today. And that's the reason why we have with us Chris Engst. He is with TELUS Babylon. Chris, thanks for joining us.
Thanks for having me on the show today, Tony.
Yeah. Okay. Let's start from the very beginning. What is TELUS Babylon? What do listeners need to know?
That's a great question. So Babylon by TELUS Health, it's a digital health service that we launched last year in British Columbia. Essentially, how I would describe it is it's a mobile app that you can download on your smartphone, and it allows you to seamlessly connect with a local doctor to have a video consultation. And the doctors that we have, they can do most things that they would do in a physical practice. So they can write prescriptions, they can diagnose, they can order requisitions for lab tests and x-rays, as well as specialist referrals. And another great thing about this service is that it's at no cost for patients in British Columbia who are covered under the provincial MSP plan.
Oh my, okay. So let's walk through what it might look like. So somebody has, for instance, an ailment, something has popped up, and again, faced with the prospect of either getting up early and waiting in line at the clinic, or trying to get into their GP, which can be often difficult, right? What does somebody need to do?
It's really simple to use. And I think when we launched the service, I think making it simple for patients was paramount to us. So we really target those who have difficulty accessing healthcare today. So that might be people who don't have a family doctor or who have needs. And it could be a Friday night at 9 p.m. And really your only alternative is to go to an ER, or even on a statutory holiday where most clinics might be closed. But it's as easy as going into the App Store on your device, downloading the application and registering. And registering only takes a couple of minutes. It's a very simple process. And then from there, what you would do as a user is you'd go in and there's a booking tool within the app, and you would book an appointment. And when that appointment starts, you'll get reminders beforehand. The doctor will actually contact you to have the video consultation. And one of the great things we like to talk about with the service is when you book your appointment, for example, if you booked an appointment at 1:10 p.m. on an afternoon, the doctor will call you at 1:10 p.m. to start that appointment right on time.
What? So there's no waiting in the waiting room for an hour?
There's no waiting in the waiting room. And I think, for myself personally, the first time I use a service, these are one of the things when you're designing a product that you think about are going to be good benefits. But when you actually use it, you look back and you say, hey, that was really convenient. The
Yeah.
appointment started exactly when I booked it, which gives you great peace of mind as a patient.
So who are these doctors, by the way? Like, because that's a question people have. Like, are these TELUS doctors? Like, who are these people? Like, and where are they?
So our doctors are all BC family doctors. They're all licensed with the College of Family Physicians. In fact, if you have a family doctor, your doctor could be working part-time with Babylon. They're based throughout the province. We have doctors, for example, in Victoria. We have doctors all the way up the island. And I would say the thing about the doctors that work for us, they're all fascinated in using technology. I think that's one of the things that we find has doctors gravitate towards working with Babylon by TELUS Health is using telemedicine type technology, which is what we call it, as well as the ability to work from home themselves. And I think we saw this really take off, obviously, with the beginning of COVID. Telemedicine has actually been in space in BC for many, many years. But I think with COVID, it really made everybody, both providers and patients, have to re-examine how they have consultations. So doctors like the fact that, just like we're doing right now, they can work from home and do video consultations with patients.
Hmm. So, but there must be limitations, of course. I mean, if somebody has an ailment that needs more attention, I mean, this must be difficult to do via teleconference, right?
Oh, absolutely. We're not fully there yet. So
Okay.
there's always going to be reasons to go in and see a doctor physically if you need to have your blood pressure taken or need to have some type of physical exam. But what our data shows us, amazingly enough, is that about 80% of primary care needs when you go to see a family doctor can be done in a virtual environment. And again, I think with COVID, it's really forced everyone to re-examine what you can do within a virtual situation in terms of when you're having a consultation with a patient. So the doctors will do everything that they would do with you, like they do when they're in person. And our doctors are specially trained too to understand if we can't help you within a virtual environment, what they'll do very quickly is identify that and recommend that you go see somebody physically.
Hmm. Are they able to make referrals to specialists?
Absolutely. So our doctors can do specialist referrals. Again, we can order lab tests, X-rays, and what our doctors will do is when those results come back in, we will book a follow-up appointment with the patient to go through the results with them.
Amazing, amazing. Okay, and as you said from the very start, MSP, so our provincial MSP program covers this. So in most cases, there is no additional cost, right?
Absolutely. And I think, again, this was really important to us when we were launching Babylon by TELUS Health is this is very much part of the public healthcare system within BC.
Yeah.
Again, the goal of this service is to help improve access for patients, particularly for those who may not have a family doctor, who have just access challenges in general. And, I would say most people within BC do have MSP coverage, which is, again, great for them. So when you go through that registration process, you enter in your personal health number, which allows us to validate that you do have coverage,
Mhm.
and then you can book an appointment and have that consultation.
Yeah, so I've gone through the process. So I have registered. I did that pre-COVID because
Okay.
I thought Babylon was a great thing, early on. And I've got to say it's very easy. So any listener here who's wondering about the process and signing up, I have to say firsthand experience here. It is pretty easy. Now, the other thing that I want to bring up too is, some listener might say, well, hey, I'm listening to the real estate program. How come we're talking about health and seeing a doctor and all that kind of stuff? Well, I have to tell you something. I have had many people who want to move to Victoria. And one of the questions they ask is, how easy is it to find a GP, general practitioner? Because I'm concerned. I have health issues. I want to make sure I have a doctor and all that kind of stuff. And frankly, I can think of one party in particular. They scrapped their plans and they did not move, even though they wanted to move, for whatever, so countless reasons. People move here for a reason. But the one thing that held them back was leaving their GP in Vancouver because it was a difficult process here. And this is years ago. So this is pre, what we have now, what you and I are talking about right now, Chris, with this amazing ability to speak to an MD as you need them, right?
Yeah, and it's that's tough, and I think we hear about stories like that all of the time in different cities across BC and frankly across the country. I think in Victoria, the stats that I read were that about 18% of people who live in Victoria, or about 60,000 people, do not have a family doctor today. And I'm sure we have all read about it, but there's been stories in the news where poor patients will line up before clinics even open in the morning just so they can get a spot to see a doctor that day. And again, I would say with services like Babylon by TELUS Health, again, the beauty of it is you can have that consultation from wherever we recommend, you do it from somewhere where that's private, where you can have that consultation. But for somebody who might be moving to Victoria, you have access to a service like this now. So again, our goal here is to help supplement the existing healthcare system for those who don't have access. So I think this would be a great recommendation for people who are moving to Victoria. And again, for that poor family that made the decision not to, I think if they had a service like this, maybe it would help them to rethink and maybe have a bit more reassurance in terms of that it's going to be okay when they're there and they're going to be able to get access to a doctor.
Yeah, 100%. And again, like I said, I think, because this was years ago now, but in this particular family, but had this product existed, I think the outcome would have been a little different, right? Yeah.
For sure, for sure.
Yeah, so we're talking today about Babylon by TELUS Health with Chris Engst, and learning all about the nifty features. So again, it's an app that you download on your phone. It's a very simple, easy process. I need to take a quick break here, but Chris, if people need to learn more about Babylon by TELUS Health, what's the best place for them to go?
Well, we have a website, so you could just Google Babylon by TELUS Health or Babylon or TELUS, and you'll find it. But I think the best thing to do, I would say, is just go into your app store. Like I mentioned before, you can literally download it within seconds and register within a couple of minutes. And it's very intuitive and easy to use. And there's a lot of other great functionality within the app too that's also available free of charge for patients.
Yeah, no cost, and that's the key.
No cost.
BC MSP coverage, no cost. So here's a call out to listeners. Sign up now. During the break here, go sign up, but we'll be back in just a moment. Thanks for coming back. You're listening to the Whole Home Show, and I'm Tony Joe. Our show comes to you every week with the support of our show partners: Denise Webster, mortgage broker with Dominion Lending Center's Modern Mortgage Group; JP Sellers, insurance advisor at Westland Insurance; and the Sitka Law Group for your real estate, wills and estates, corporate and personal injury needs. If you need help or direction in your real estate transaction, give any of the Whole Home Show team members a call. They would love to hear from you. And as a reminder, you can find their contact information by going to cfax1070.com. Look under shows. There you'll find us, the Whole Home Show with me, Tony Joe. All their contact information is there. Or you can always, if you are a podcast listener, download any of our programs over the course of the past 4 years. We're at episode 180 right now. Lots of great information. Go to iTunes or Google Play, and everything is there. We'd be happy to help. Having a great conversation today about health at home. We chatted earlier with Don Swainson, Vital Health Pharmacy. And as a reminder, you can get your prescriptions delivered to home, and working with a boutique pharmacy that does not sell cigarettes or pop or any of that kind of stuff. They are completely concerned with your health. Great spot to connect with. And we've just had a conversation and are continuing a conversation right now about Babylon by TELUS Health. And we have coming back with us here right now, Chris Engst. Chris, again, thanks for coming back.
Thanks for having me again.
So we talked about how easy it is to download, how MSP coverage covers it, how you don't need to wait in line. You know, you're talking about people going early and waiting in line at the clinic. What we didn't mention is how a lot of these clinics have a cutoff, so they stop, at once their day is full, right? And when you have an ailment, hey, I've had it. I've had, I injured myself and I needed help, and that's not a good thing, sitting around and waiting, right? And what you have to offer is being able to go onto an app and boom, your doctor calls you when they say they're going to call you, right?
Yeah, for sure. And I think we pride ourselves on access as well as being able to get an appointment in a timely fashion. So on the access standpoint, one of the things with our service that is really great for patients is we're open 364 days a year. So we're not open yet on December 25th, but I suspect that'll change over time too. We're open on statutory holidays. We're also open on evenings and weekends. And I think one of the things we find is that patients really find it beneficial where, again, it could be the evening when normally they might go to an ER, or it could be, we just had Thanksgiving and it's Thanksgiving Monday and there aren't a lot of options. So they can log in, they can book an appointment and see one of our doctors. We also aim to be able to get an appointment within typically a couple of hours, though I'd have to say I'm on there a lot checking our wait times, and, in many cases, you can book an appointment within a matter of minutes. So it's really great for patients to be able to do that.
Well, okay. Wow. Again, I'm used to either waiting in line at the clinic or booking my GP, which is usually 3 weeks or so out. which is a complicated process. I've got a question for you. So the doctors that the MDs that you have who are working with the Babylon by TELUS Health program, why do they do it? Like how do you find them, and what's their what's the word I'm looking for? Motivation is not the right word, but you know what I mean. Like,
Yeah.
why are they on Babylon?
I think that doctors decide to join Babylon for many reasons. And again, our doctors who work for us, they're all licensed family physicians within BC. They're all local
They
doctors
have their
across
own
the province.
practices. Yeah.
They all have their own practices. They all generally work full time. They have patients who are rostered, and what they will do is they'll often work for us, 8 to 12 hours per week. And I think again, when you think about kind of if I was to look at the profile of a typical Babylon doctor, they're all fascinated with how they can use technology differently. They all believe in the cause in terms of how do we help overall with the systemic issue we have with access challenges for Canadians. And I think Babylon offers a great opportunity for them to participate in helping with those goals. The other benefit too of Babylon is again the flexibility that it offers to physicians. And we don't talk as much about this, but for physicians to be able to work from home too, right, is I think a great convenient aspect of the service that also offers benefit for them. I saw a note from one of our doctors who was just returning from maternity leave recently, and she was thanking the Babylon medical leadership team because this allowed her to be able to continue part time working for Babylon, coming back from maternity leave, where she didn't think that this might have been possible beforehand. So I think there's lots of benefits for doctors, which make them attracted to this type of model.
Well, in many ways, it's no different than us in the real estate industry, where we've got to be mindful of things like COVID protocols and limiting actual physical visits with people. And we've had to find ways to deliver services like doing these virtual open
Hmm.
houses and doing walkthroughs by FaceTime and all this kind of stuff. So it makes sense to me that the medical professionals would also want to be able to deliver that service while at the same time being mindful of, because hey, it's the health professionals that people are often most concerned about. It's like they're visiting people,
Hmm.
in a clinic, in a closed, environment. Are they doing the best they can to stay healthy? And it seems to me like Babylon is a great way
Well,
for.
yeah, and I think everyone's had to adapt. And I think the great thing too is for those of you who do have family doctors out there, I would encourage you to check. Most family doctors now, they are offering virtual consultations too, so that you
Mhm.
can see your doctor safely from home. And again, I think with COVID, really everything turned upside down overnight, where we really had to reinvent things in terms of thinking about how do we ensure that doctors can still see their patients and that it's safe and safe for both sides, both the patient and the provider. This is, I think, when you think about it in the long run, this offers a lot of flexibility and greater options for patients as a whole in terms of how they can access care.
Fantastic. Other features? Are there other features that you can describe here other than what we talked about so far?
Yes, for sure, Tony. There's a lot of features. So we talk a lot about the ability to access a doctor on Babylon by TELUS Health. We recently launched something called Health Check. So within the exact same app, you can go into the app, and again, this is at no cost to patients. It's a quick health survey tool that you can use. So you can go into it, and the idea behind this is it gives you a good snapshot of your risk propensity against the top 20 most common diseases and illnesses. So patients like this, they can go in there and they can get an understanding of how healthy or perhaps how at risk they might be. We also have the ability now to offer in language consultations too. Patients can call in and book an appointment. So if they want to have an appointment with a doctor who speaks Cantonese or Punjabi or Mandarin, really our
Oh,
goal is to strive to, again, along the whole theme of access is, can we offer appointments in different languages too?
that's amazing, because geographically that might not be possible, right?
It may not be, and again, I think again this is a great new benefit that we've been really pushing hard to be able to make it available to our patients. And the initial uptake has been good, and I think this is something where we're just going to see a common theme in terms of growth in that area
Yeah.
over the next year and years to come. Something else with the service, which is really neat too, is after you've had a consultation, you can go into what's called the health record. So a health record again is a part of the app where you can look at records or health notes that your doctor writes into the app for you. Uh, data shows that most people don't remember a lot of what they hear, especially if it is a stressful time. So if you're having a consultation with a doctor, you may not remember a lot of that consultation.
Yeah. Yeah. Yeah.
Immediately
Well,
after an
and
appointment.
this is normally why often a family member is there taking notes, right?
Exactly,
Yeah. Yeah.
exactly, exactly. Our doctors do that for you. Within a few minutes of having your consultation, you can go into your record, your health record, and you can go back and you can see what the doctor wrote. So the doctor will say things, for example, like you presented with this, so you had a certain type of issue. We discussed this. Here was my diagnosis, and here's my recommendation in terms of next steps. And I've used those notes myself. I find them really valuable because, again, you can go back over time and you can look at that. It could be something too where you might want to share that with a caregiver or a spouse, just so you have access to that information. And you can also go in there and you can access your history of your prescriptions and all the other things in there. And really, for us, that's around starting to encourage patients or citizens to create a digital health footprint that they can take with them through life.
Amazing. Oh my goodness. Okay. Um, so aside from that, Chris, because we're talking about, you know, MDs, clinics, all that kind of stuff. Like, is there any plans for like a physical site at some point, or?
Physical clinics, that that is on our roadmap, and we actually do have some exciting news. We recently opened our first physical practice in Vancouver, so we do have a practice
Oh,
now in Vancouver.
okay.
It opened this summertime, and we are in the process of opening a second physical practice in Victoria, of all places. So the
What?
timing of this show is great. So that'll be opening this fall
Has
in
this? Hold on a
or
second.
next
Has this
month.
is this out yet, or is this like
It's
the
not.
first?
It's not. It's not. So
Okay, our
when
our
you ask,
CFAX
yeah.
listeners get a little head start here. Oh
You
my
get a head
goodness.
start on this, and I may get in
Okay.
trouble for mentioning this because I'm not sure if I'm supposed to yet. But
Okay.
what the heck? So we are opening it, and I thought the timing of doing this show was great because,
Yeah.
again, we're doing this for a few reasons. I think first and foremost is you asked the earlier question in terms of can you do everything virtually? The answer is no. There's always going to be needs to have to go in and see somebody physically. So having these clinics allows us to bridge that divide where we can have a seamless integration between having a virtual experience and a physical experience. I think also we are looking to strategically locate clinics where we know we have big access challenges where people can't find family doctors. So again, these are geared and targeted towards people who may not have a family doctor today. We know Victoria is an area where, as you'd mentioned earlier, there are definitely challenges.
Yeah.
The way the experience will work with our physical clinic. So if you fast forward in Victoria a couple of months down the road is you would continue to use our virtual Babylon by TELUS Health service as you would today. And if you needed to see a doctor in person, if they needed to do some type of physical examination or take your blood pressure or something else, and you don't have a family doctor and you'd like to use our practice, we will then do a soft referral into our practice. So then you can have an appointment booked there and see a doctor for a follow up. And again, we think this is going to be great for citizens of Victoria who are struggling with that today. And we're super excited that this will be available in the coming months.
Amazing. Because the other thing we haven't talked about too is doctors, MDs or GPs retire, right?
Absolutely.
And all that stuff. So okay, and you said James Bay, right?
Not James Bay. It's actually right downtown Victoria.
Oh,
So it'll be right in the heart of downtown, the
okay,
downtown area near Parliament.
okay.
So we haven't really announced that yet, but it's just really this is a sneak peek to say that it's
So
coming
so
and that
basically,
it'll be
our
available soon.
listeners should be keeping their antenna up for announcements
Oh,
about.
absolutely.
Yeah.
Yes. Yeah.
Fantastic. Okay. Well, again, just to recap here as we wrap up our program for the day, Babylon by TELUS Health. Again, for our listeners, this is an amazing option for you. If you are struggling with what to do about whenever you need to go to a clinic, a GP, whatever, download the app now. If you have troubles downloading apps, get your kids to do it for you, right? And this, we're talking all platforms too, right, Chris? So Apple, Android, everything, right?
And I'll mention our oldest user. She sent in a testimonial. She's 96 years old, and her
Yeah.
testimonial to us was, "It's great. It's just like FaceTiming my grandkids. So if she can do it, you can do it too."
I love it. All right. And to our listeners, if you need more information, go to your app store or go Google Babylon by TELUS Health and all the information. So thanks very much for coming, Chris. So much great information. This is amazing.
Thanks for having me on the show, Tony.
All right. And to the rest of our listeners, we'll be here again for you this time next week.